Tonight on Extreme Makeover, two people are about to have their lives changed forever. Sandra Allen.
That's yours.
Sandra's husband of 34 years died a year ago, and she is searching for a new beginning. Sandra Allen is a 53-year-old widow whose husband died within the past year. For the past 15 years, he was disabled, and Sandra was his primary caretaker.
He worked with undercover narcotics. He got thrown off a car, and he got shot and disabled from that. Jon was my best friend in the world, my soulmate, my love. We just talked a lot. He made me a really, really strong person inside. I can't explain how he did it. He just did it. I feel really ugly about myself. I hide my mouth when I smile because I really believe that turns people off when you have ugly teeth. My skin is kind of sagging, you know, with the age.
You've been chosen for an Extreme Makeover. You're going to Los Angeles.
Are you serious?
It's yours, Sandy.
Oh my God.
It's yours.
Oh my God. This is a miracle in my life. I never thought would happen. I'm shaking.
And her next stop is to visit plastic surgeon Dr. Perlman.
What I would love to have done is, I would love to have a facelift, and I would love to have it tightened through here and also through here. And also I thought about getting a little bit of smaller nose or something.
Is that right?
Yeah.
Okay. I noticed some hollowing of your cheeks as though you'd lost some weight. And it's just leading me to wonder if we, when we do the facelift, should consider adding a little fat in here just to give a more youthful look rather than a somewhat sunken look. But I would actually consider taking a little fat from another part of your body.
Take it from right there.
Okay. Got a little extra to spare.
Oh, got a lot of extra.
That's what every woman tells me. It's not always true, but at least every woman thinks so. But with your excellent bone structure, I think we can help you. Now, you have a little droopiness of the skin here. Not a great deal, but I think lifting your face and a little work on your neck would be helpful. We don't need to be aggressive there because the problem is rather small.
All you want.
Is that right? Okay.
And I also want to get my breasts lifted.
Oh. So undoubtedly, you're sufficiently droopy that we need to consider a full uplift.
Right.
To my eye, you're not really even a mid-C, but I think we can aim for an upper C or a lower D, raising your breasts and your nipples up, and I think that's going to make a tremendous improvement for you.
It would make me feel good.
I'll bet it would. I'll bet it would.
I've never been through this before, and it was so exciting. I mean, my heart was pounding, 1,000 times a minute. It's just so exciting to know that this could happen. He explained to me how much better I would look and feel about myself, and he just made me feel great.
A difficult day behind her, Sandra's spirits are lifted after hearing the plans for her surgery. Sandra is getting a facelift, a brow lift, and breast implants.
Tomorrow morning I have surgery, and I'm kind of nervous about it, a little scared, but really excited. But it's going to be awesome. Never in a million years I thought this would happen. That's true. But I do miss you guys. I love you too, babe, and everything will be okay, so you don't have to worry. Okay, I love you very much. Okay, bye.
The next morning, Sandra is on her way to surgery.
I know it's going to be hard, and I know it's going to be uncomfortable, but it's going to be worth it. It's going to be totally worth it.
During Sandra's preliminary examination, Dr. Perlman informs her that he cannot perform the breast surgery until her abscessed teeth are extracted.
I spoke with Bill Dorfman the other day. I could not safely put in implants for your breast surgery if there's infection going on. We probably need to delay that surgery somewhat, but we'll work out the details because we all want to get it done for you if possible.
Knowing they can't perform the breast enhancement today, they decide to proceed with the rest of her scheduled surgery.
This is just a remarkable day. Nothing I would ever dream of. I would never thought this would have happened. Just have a seat there.
It's going to be easy.
Dr. Perlman begins Sandra's surgery by removing fat from Sandra's stomach to be injected into her cheeks and lips.
The beauty of fat injections is that there's no rejection. It comes from your own body. It's not a foreign material. You can see the effect of the fat here versus here where I've not yet placed the fat.
Now it's time for Sandra's brow and facelift.
Her skin and tissues are so thin that we're elevating them very cautiously, but it's going very nicely.
And finally, Dr. Perlman resculpts Sandra's nose.
Sandra's nose really just needs refinement. I don't want it to be a dramatically different nose, but I want it to remain natural looking. Congratulations.
As Sandra wakes up, Dr. Perlman calls her family to reassure them that the surgery was a success.
She'll look great. I think you'll be very happy with the way she looks. She'll have a little swelling, a little bruising for a while, but she was just a trooper. She's all excited and being very cooperative. I'll tell you love her, and they've been thinking about you all day, Sandy, okay? She heard that. She heard that.
After 8 hours of surgery, Sandra is ready for some rest and recuperation. The first round of plastic surgery is finally over, but Sandra still faces the challenge of major dental work and breast surgery. Now, it's Sandra's turn.
How are you feeling?
Oh, I'm feeling great. The swelling has really gone down.
Your face really appears to be healing beautifully. Your neck continues to look great. The contour is terrific.
I've always wanted a nose with a little shape to it, so I can't wait. I'm going to feel great.
Here's the mirror.
Oh my God, that looks totally different.
It looks so nice, actually. And your little, you see you're kind of puffy through here. That's going to come in. But
much firmer. My eyebrows are higher. My cheeks are filled in. My lips are fuller. And my nose has shape to it. It's amazing. I'm very excited.
2 weeks after her initial surgery, and with the infection in her mouth now treated, Sandra returns to Dr. Perlman's office to finally get her breast augmentation.
The surgery was delayed because I had really bad bacteria in my gum area. So when I got a phone call the other day and said I could have my breast surgery, I was so happy. My teeth and my boobs were number 1 and 2.
I think this is going to provide a very dramatic change in her self-confidence and her body image, because her breasts look like those of a 75-year-old woman, and I think we can give her fullness and uplift that will really make her happy with the way her breasts look. In Sandy's case, the plan is to both augment her and lift her. She's very droopy. Unlike Karen, I choose to place it through the uplift incision on her breast. It's going to be very nice. Sandy's surgery today went very smoothly. It's going to make her feel a lot younger and more vital and a little bit sexier too, probably. She's been lifted a good couple of inches. Her breast no longer will have that saggy appearance.
I feel fantastic. I just feel a little tight in my chest. But that's about it. I feel really good.
And this was Sandra Allen just 7 short weeks ago.
I am looking for a new beginning in my life. I need a new beginning in my life.
But that's all in the past. And now they're ready to step into the future. And the first one to take that step is Sandra Allen. But she doesn't look like a grandma anymore.
I'm probably more nervous than she is. Just the joy in her voice is just something I haven't heard in many years. I couldn't stay in my seat. I had to get up and hug my mom. She looks my age. She looks my friend's age. And that's what I have to worry about.
Oh, wait, I gotta see you, I gotta see you, I gotta see you. Oh my God. Eyes were so bright and her smile was so big and her boobs are so huge. She was amazing.
Sandra got a brow lift, a facelift, a nose job, and a neck lift. She also received fat injections in her lips and cheeks, had her breasts lifted and augmented, LASIK eye surgery, and a complete dental restoration, including whitening, periodontal therapy, bonding, and partial dentures.
My father's rolling in his grave right now, just wanting to come out. He's ecstatic about it. I know he is.
When I look in the mirror, I see a different person than I seen 7 weeks ago. I see someone that, feels good about themselves and so positive and a lot more energetic, and I think that's going to carry on to the rest of my life.